You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
My name is Holly Pager. I'm the residency program director for the University of Cincinnati Physical Medicine and Rehab program. And I have Ashley Bulger on with me as well. She is the program director for the triple board program, which includes pediatrics, PM&R, and peds PM&R. I'm going to actually have her go first because I think she has to get off soon. So I'll go ahead and let Ashley talk.
Thanks, Holly. Hi, everybody. My name is Ashley Bulger, and I appreciate you guys doing this again this year. This was such a cool opportunity, yes, last year. But basically, just wanted to give you a little bit of background, and Holly will go through a lot of the logistics for the University of Cincinnati program, and almost all of those mimic this one, with the exception of we do a pediatrics residency for the triple board program. And so for those of you who might know that you guys are 100% committed to doing pediatric rehab, this is a unique training way to get there. So we're one of 3 programs in the country. It's a 5-year program where your first year is a pediatrics intern year, just like any other pediatrics intern in the country. And then for the remainder of your 4 years, you basically are flipping back and forth every 4 to 5 months, doing equal amounts of pediatrics as well as rehab rotations. And so, over the course of those total 5 years, you're basically doing enough rotations that at the end of all of this, you're eligible to sit for pediatrics boards, you're eligible to sit for PM&R boards, and you're also eligible to sit for the PRM or the pediatric rehabilitation medicine exam as well. Getting a lot of variable experiences throughout both sides. So, going through the different ICU rotations in pediatrics, both inpatient and outpatients rotations, as well as various subspecialties, and then all of your core PM&R rotations you are doing as well. So lots of musculoskeletal, EMG, prosthetics, all that good stuff. But what makes us really unique is that over the course of those 5 years, you're getting a total of 12 months of pediatric rehab rotations. So those are a combination of inpatient and outpatient months, and they are scattered between your PGY2 and throughout PGY 5-year, with certainly the bulk of them being more, in your PGY 4 and 5 years. So basically backloading them. But by the end, you're getting a total of 12 months. So definitely a unique program. And like Holly said, I may have to jump off in a little bit. So certainly if anybody has questions about this, I believe my contact information is at the end, and I'm certainly happy to answer questions if I'm able to stay on. So I'll turn it back to Holly.
Thank you. All right, so University of Cincinnati College of Medicine, just some fun facts. It was established in 1819, so that makes it actually the 8th oldest in the country. We have the UC College of Medicine has 56 accredited residency and fellowship programs and 690 residents and fellows total. UC Health is Cincinnati's only academic medical center, and it's comprised of the main hospital, UCMC, Westchester Hospital, and then the Daniel Drake Center for post-acute care, which is where all of our inpatient rehab rotations are located. We have some outpatient rotations at the Drake Center as well. UCMC is the region's only level 1 trauma center, and we see more than 1 million patient encounters annually. So some facts about our program specifically. It was established in 1988. It is a categorical program, so the first year is spent with the internal medicine, but at University of Cincinnati. We take 3 residents per year for the adult PM&R program, and then 1 per year for that triple board program that Dr. Bulger is the program director for. We have some clinical sites that include the main hospital, which is where we do consults primarily, the Drake Center, which is where we do, as I said, the inpatient rehab rotations, and also some of our outpatient rotations. UCGNI, which is the Gardner Neuroscience Institute, where some of our outpatient rotations are located, including our continuity clinic. And then UC Florence and Holmes are some satellite sites where we have outpatient rotations. And then the Children's Hospital, CCHMC, is where we have our pediatric rotations. And then we also rotate at the VA for outpatient rotations as well. We do home call. Home call is week long from Friday to Friday. I mentioned the Gardner Neuroscience Institute. This was opened recently in April of 2019. It's a 114 square foot building, 125 physicians across 15 specialties within sort of neurology, and PM&R is one of them. We have 67 active and future clinical trials for neurologic conditions. That's just a picture of the building. So some highlights of our program that you might not easily find online. So we do have protected didactic time. This is on Thursday mornings, usually starts around 7 or 8 and ends around 11 or 12. There is a continuity clinic for all of our residents. Our PGY2s pick a clinic of interest and kind of stay in that clinic throughout their PGY2 year. But our PGY3s and 4s are in their own continuity clinic with their own patients and doing their own billing. We do have sports coverage. We have one of our faculty members is a sports medicine physician, and he is a physician for hockey team, and also involved in training room and game coverage and high school sports. We have a shared Google Drive with all of our resources for all of our residents that's sort of been accumulating over the years. So it's full of multiple resources. We do have a wellness curriculum as well. So every quarter we have some sort of wellness component of our didactic curriculum. And then twice a year, we try and do something where we kind of step away from clinical duties and do something different. And then once per year, we have a wellness retreat or a resident retreat. So that's a full day offsite retreat where our residents spend sort of half the day on like professional development, and then the other second half of the day on like program improvement projects. Our program is fairly customizable. It is a smaller program, so it's easy to sort of move pieces around and customize it a little bit to help residents kind of grow. As far as clinical rotation, so for the PGY1s, there's 6 months of internal medicine and then a smattering of other rotations that are sort of fitting for PM&R. So neurology, the neuro ICU, rheumatology, ortho, urology, radiology, and we do have 1 month for our interns of PM&R consults, so they get exposed to that early on. For our PGY2, 3, and 4, you can see the rotations listed here. I won't list all of them out, but you can see that our inpatient rehab rotations are heaviest as a PGY2, and then decrease in amount of time that you're spending on inpatient rehab as a 3 and a 4, while increasing some of your outpatient rotations, including EMGs and elective months. We do rotate at the Children's Hospital. Our residents do 1 inpatient pediatric rotation there, 1 month of inpatient peds and 1 month of outpatient peds. This is a really great experience for anyone interested in pediatrics who doesn't end up doing something like the triple board program. It is one of the top ranked children's hospitals in the country, and it's the largest pediatric rehab division in the country. So a lot of exposure to a lot of interesting cases. As far as what we do at the VA, we have some EMG and then some outpatient clinics, including spinal cord injury, traumatic brain injury, and prosthetics and orthotics. Regarding our didactics, so we do have an intro to PM&R lecture series. We have conferences that occur monthly with both EMG and MSK. We have journal clubs. Biannually, we have an ultrasound course where we've invited actually, other hospital systems within the tri-state area to come and join, but one of them is upper extremity and the other one is like, I think, a wrist, and then the other one is, I want to say, the knee. And then also a part of our didactics, we have the gross anatomy series. And then we have, when our residents are on their pediatric rehab rotations, there are pediatric rehab lectures. And then there's also a regional pediatric rehab symposium that happens every other year. Research opportunities. So our residents are highly encouraged to participate in research. If they do have a case report or some sort of research accepted at a national conference, then they are given travel funds to go to the conference. We have an annual resident research day that happens at the end of the year every year for all residents to present any ongoing research projects that they have been working on. And then it's not really new anymore, but we have a motor recovery lab that one of our faculty members conducts his research in. He's a neurologist who did a PM&R fellowship and does very interesting research in motor recovery for stroke patients. So as far as teaching opportunities go, we do like to encourage our residents to grow as teachers as well. And so we have a, for the medical students, there's a medical student ultrasound curriculum that the PM&R residents and faculty teach wrist ultrasound to the medical students. There's also a medical student MSK clinical skills lab. So as part of their clinical skills labs, the musculoskeletal component, which includes the knee, the spine, and the shoulder, our residents and faculty teach that part of the clinical skills lab. The ultrasound symposium that I mentioned earlier happens, there are 2 half days per year. And then our 3rd and 4th year medical students are on inpatient and consult rotations throughout the year. And so our residents are teaching on those rotations as well. Our residents are also required to give a grand round. So as a PGY3 and a PGY4, they give a grand rounds presentation to the entire division. As far as where our residents go after graduation, it's sort of mixed. As you can see here, this is the past 5 years. So it's mixed between going on to fellowship and going into practice and going academics or private practice. It's sort of a mix of where they've gone. And then, you know, we like to give back to the community as well. And so one of our big events is the Spinal Cord Expo, which we've actually renamed as the Ability Expo. So it's not just for our spinal cord patients, but includes our amputee patients and stroke patients and other patients as well. But this event is held annually. It's actually coming up in a few weeks, I believe. But basically it's a large expo for any patient with a spinal cord injury to come and meet with vendors about different equipment. And there's usually a speaker that comes, and then we often play wheelchair basketball as well, which is always fun. And then we try and have fun too. So we also try and get together when it's not COVID to do fun things. This picture in the top left is we get together and play sand volleyball. We're actually doing this fairly soon as well. And then the bottom right, our program coordinator has a lake house and she invites all of the residents to every year. And these are our residents, and I think that's all I have. Any questions? See if there's anything in the chat. See.
We got a couple questions here for you. First one seems like, what's your favorite part about Cincinnati? And the second question is, how much exposure can residents have with the pediatric chronic pain clinic?
Good questions. I was just seeing those too. So favorite part about Cincinnati. So I always tell students actually that I'm not from Cincinnati. I grew up in Colorado, and I moved to Washington, DC for a little bit. And then I was in Arizona and Chicago and ended up in Cincinnati, and it has pleasantly surprised me. I think honestly, I think is the city dog friendly? Does anyone see my dog in the background here? It is fairly dog friendly actually, but there's lots. I think my favorite part actually is, and what I was most surprised about is a lot of the outdoor activities, just as like a fun thing to do. That our family recently got a kayak, and there's a few rivers and lakes around that close by for kayaking, and that's really fun. So that's probably my favorite part. I've also been pleasantly surprised by the restaurants. There's some very good restaurants in Cincinnati. And that's coming from like Chicago. I did my residency in Chicago. And then how much exposure can residents have at the pediatric chronic pain clinic? So unfortunately, Dr. Bulger had to leave. And so that would be a great question for her. But one of our pediatric pain faculty member actually went through the program recently, and so I know him well, and so I think that that opportunity is there and available. And for our adult, at least on the adult side, the part that I'm involved with, we can certainly plug that in with electives and things like that. Great questions. Someone asked a question about kids. So I have two young girls. So the schools are great. There's some really great schools in the city. And then family activities is another thing I would actually usually touch on. So I came here without a family, but since I've been here, have grown, and we now have two young girls. And so all of the things I do in Cincinnati are family things. So there's a great zoo, there's some great children's museums, lots of great parks. It's very easy to get around. Again, like I said, I was in Chicago, and so I can't even imagine trying to get to my fourth floor walk up with like all my strollers and things. Everything is 15 minutes away. You park right in front, and you get that like easy to access everything, but without like you get all the big city things without all of the hassle, I guess. And pain exposure as a PGY2. So at the VA, you get some pain exposure, especially with like spine injections and things like that. And you do spend some time at the VA as a PGY2. And also as a PGY2, if that's something that you're interested in, that could be your clinic that you end up doing your continuity clinic with. Skyline chili. Someone asked about skyline chili. I have to say I have not tried it actually, and I don't know if I'm ready to. There's a very people either love it or they hate it, and I don't know if I'm ready to try something that people don't like. Oh, how social are the residents outside of clinic? They're very social. It's a very tight-knit group actually. Our residents they get to spend every Thursday morning together, but then they do a lot of activities outside of work as well. It's I think everyone says this about their program, but it does feel like a family.
Got about 2 minutes left.
And it's a mix of, within our residents too, it's a mix of, there are some who are married, some who are single, some who have kids, and it's sort of a nice mix, and they all spend time together. Sports medicine. So that question hasn't been asked, but the associate program director for our program is Tim Foster, and he's sports medicine trained, and he spends a lot of time with the residents. In fact, I'd say most of our residents right now are interested in sports medicine. And so they spend a lot of time with him with sideline coverage or in his clinic. One of our residents recently, with his help, sort of founded this adaptive sports clinic. So for patients with disabilities. So there's the adaptive sports clinic, the regular sports clinic, sideline coverage for both high school and college level athletes. Lots of exposure. Oh, fellowships. So, so for fellowships, we actually have our first musculoskeletal fellow currently. So this is our first year of our MSK fellowship. And then there's also the pediatric fellowship. And those are the two we have currently. One of our recent graduates just started her pediatric fellowship at Children's.
So I think that's all the time we have for this evening. Thank you so much, Dr. Pager, for doing that presentation on behalf of your program, University of Cincinnati.